We are sitting here today with Dr. Boris Petrikovsky, Director of Maternal and Fetal Medicine at New York Downtown Hospital. Good evening, Dr. Petrikovsky.
Good evening, Sean.
We have discussed in the past few months the topic of stem cell research. Today, I would like to talk about what are the advantages and disadvantages of cord blood banking.
Well, let me start with the second part of the question. What are the disadvantages of cord blood banking? And there are really none, except for expense, because currently insurance companies do not cover cord blood banking and consider it probably an experimental procedure. But there is really no harm to the baby, no harm to the process of labor in the process of collecting umbilical cord blood and storing the umbilical cord blood. So the only disadvantage is that it costs money, and various companies charge different amount of money, from $1,200 to almost $2,000, plus some do charge annual fee for storing umbilical cord blood. Some companies do not charge annual fees, so really it's important to investigate. Regarding the advantages, as you know, we all know now, there are a number of reports in the literature, in the medical literature, when cord blood that was saved and stored eventually was used and saved the life of the infant, because there's certain diseases, mostly the diseases of the blood, that require the use of the stem cells. And the only stem cells that you can really safely collect and store is the umbilical cord. So it's almost like you are somehow preparing the spare parts, like when you buy a car, you buy a spare part, and when that particular part is broken, you can just replace it. So that's pretty much the analogy that I use in my discussion with the patients regarding the advantages of umbilical cord blood banking.